Hello, everyone. Thank you very much for having me. And my big thanks goes first, of course, to Asia Berlin Summit, to the organizers, and have the opportunity to share some insights about so important topic which influence our daily life. So actually, the topic itself is not 100% accurate, right? We are still in the COVID time. Everything started with COVID. I have a very personal touch. It started on the day, the 28th of January 2020. Why? What is it about? So before the COVID hit the news lines, I was privileged enough to have a delegation trip with the German government in China. At that time, nobody heard about COVID. And this was the day when I took the flight back to Germany from China. And 2 days later, the borders are shut. Everything has changed. Everything has evolved totally different for our daily life. And we know it's now more than 1 year later how COVID has impacted our life. And we learned the suffering, but we also learned what we can become better as a society, as economic powers, but also civil society. So we have, of course, very direct consequences of the COVID. You know, everybody from us have already some contact with this, either testing, vaccination, and of course, unfortunately, some of you or some of us have also have severe symptoms, have to go to hospitals, and less than 10% even have very severe conditions and suffered with their lives. So there's a direct cost related to economic because many of the supplies, medical supplies, and all this pharmaceutical goods for the treatment of patients have to be provided. And the second thing is also indirect kind of cost which we have to encounter. And now we are not only facing kind of money crisis, but a health issues more than only your physical state, but also your mental state. So why it's important to look into the COVID concepts more closely is, of course, we know that because of the regulatory changes, the social distancing, and the chronic disease, many of the appointments have been shifted later. Because why we have the time we suffer under COVID, it doesn't mean that other diseases vanish. They're still there. And many of the patients either don't have the capacity or their appointment get canceled to get the right treatment. So we see a very high peak of heart attacks at home because of why? Separation and lockdowns, and nobody have time to treat those kind of patients. And that's why we see a lot of appointments, both in and outpatient, get canceled in many countries. And that's why the problem just delayed to later stage, where we have to see how this impacted both in the healthcare system and in our society. And as I mentioned, there's other dimension about health, which is your mental state. And we learned that both the patients themselves, the population, but also the healthcare caregivers like nurses and doctors, they also suffered. Reported more than 50% of the known physicians suffer very severe mental diseases after have very intensive treatment period for the COVID patient, because it's not only the physical force that you have to bring, but also the mental strength, and this is why we have to also regard this as a very important factor. But as I said, we have to cope with the situation. We know COVID is not something we plan for, we desire, and we wish for, but we have to live with that. And this is how this also was regarded as an opportunity. And we have seen, even before the COVID, like in Germany, we have already a very strong pace on digitalization. But because of the COVID, we have seen even more dynamic coming. In sense of telemedicine, AI usage in healthcare, optical triage in the hospital, how to link the patients into the journey, and also what does it mean for the societal and regulatory changes. And just to give you some examples later, we have to see, for example, telemedicine. Everybody talk about it, but why it is so crucial? Because it doesn't only mean that I can visit a doctor without having a trip or going out, but it also means a kind of democratization. For example, in China, even the country is very large, just after Russia, Canada, and comparable with the US. But China has very little usable land, and many of the countries, like Tibet Plateau, there's not livable. So the concentration of the 1.4 billion people is very high, but also the disparity between rich and poor. You heard about the coast region and the west region. So for China, for example, to have telemedicine is not only a technological advancement, but also a democratical and more civil service, because for that sense, they don't need to build hospitals everywhere. And they can treat the patient even from the rural area where they don't have the good access, still have the good world-class treatment. And for that, I think is also here in Germany, we have so many new platforms coming, and they have been doing great jobs, and reimbursement has also going up. And AI in healthcare is now a very hot topic. Many universities, I think Stanford is leading this. They have published and experiment with many applications. And even we don't have in daily life encounter with the real AI, because what does it mean is that the AI application enables the 3P: predictable, personal, and preventive. But because it's so personal, it makes it very hard for patients and doctors to compare the outcomes. So the safety issue has always been in the game. And then we have to do with a trend, which is we know about demographic changes. And this is something Europe and China both share: aging population. And we have to make sure that even we have more and more older generation in our society, how we take care of them. And that's why home monitoring, home application, home care is so important, because nobody wishes to be just sent to some nursing homes far away from their known houses. So as I said, I want to bring some examples to underline what has changed or what has evolved during the COVID time. And Ping An Good Doctor, from the very big pharma insurance company in China, they have a very well-known application way before already before the COVID hit. And they see, of course, because of the development, very huge increased revenue and visitors in the platform. So they have developed themselves not only to a telemedicine platform and to offer online consultation, but also they involved to more all-in-one stage of a company where they also deliver drugs, and where they also provide a platform for physicians to treat in offline sessions. So that's why this is kind of this business idea, which has raised in China very big attention. The second one, I think, is well known, which is probably also from Berlin, ADA. They just closed a very big round as well. And this is a company which has very successfully, from the very beginning, I think 10 years ago, to really use the data, use the smart technology to not only to find the best treatment, but you as a daily user, as a patient, in the pocket to know where I can, in the very protected way, find the best solution, best doctor. I think this is also an enormous advancement based on the development, based on the technology, but also the openness of the users who are willing to share their data, of course, at the end of the day, to make everything working. And then there's one example called InferVision, which is from China. And as we know, okay, where is the AI actually used most currently? And most cases where it started is in radiology, where the scanning of the images can be predicted, can be seen and analyzed by the machine learning and AI better. And that's why it's also this company has risen very fast, because also the COVID to analyze your lung functions and other areas of our bodies. Last but not least, is also a proud Berlin company, and they make pacemaker for your heart, which is also important for those who have the heart deficiencies. And so they have also very well known, because they are also privately owned, by family business, and but they are still very spread in the world over 60 countries. And they also see, of course, because both COVID and also other cardiological related diseases, they have seen much growth in this time. So just to conclude, there's many challenges we face when we want to move forward to digitalization. We have to make sure that not only we collect and use the data, but the data can also talk to each other. And for that, we need unified and European Union and national level in Europe to create a framework to make that happen. And also, we have to make sure that the trend, the force, the money doesn't stop only because we could solve the COVID issue. So we have to make sure that this kind of development can go further. And last, I want to just share some of the differential points between China and Europe. And we know that China has already very big advantage when it comes to digital penetration, where many mobile users and the number of internet users, and also the readiness of the digitalization. And of course, as I said, the willingness and demand has risen in China much faster than in Europe. And because of the data is easily and fastly collected and used, the AI development, R&D is also very present in China. And last, I think China is also very heavily interested because of social issues to provide the best possible internet connection to make sure, as I mentioned, the 5G networks to enable telemedicine. And in Europe, we have a different program where we also have the financial support, like the EU for Health program. And also, we have seen over 1,000% growth in Germany when it comes to telemedicine. And I think, even many people talk about, data privacy issue. Most of the people in Germany are willing to share the data, to use the digital patient record, to use the telemedicine, to talk to their doctor via video. I think the perception that nobody wants to use that is wrong. I think the most important is to make sure that we proactively ask and inform the patients, and so that everything can go forward. And I think the current government since 2018 have done great jobs when it comes to different legislative pieces to reform this kind. So to finish up is, of course, the question, we have very difficult time, both because of the COVID, nobody can travel easily between the two continents, two regions, but also we know that a political shift has turned not in the best way. So I think because of this kind of tension we have seen, I think the healthcare collaboration has become so crucial, so important to find a common sense. And I think that the COVID just proved to us that regardless of what happened in the political and stage, we have to ensure that some of common sense has to be granted, and that we have to work together regardless norms or digitalization. We have the same standards, or in sharing data and clinic study, research development, or come to really to practitioners, exchange between nurse and doctor of the two nations. With that, I want to close my speech, and thank you very much.
Thank you. Please stay on the stage, because we have a couple of minutes left before we go to the lunch break. Are there any questions from the audience for our guests so far? Because I would like to know more about you and about SILREAL. What is it exactly that you do with the company?
So the company was founded with one very big motivation, which is how we can bridge Europe and China in healthcare. I'm very devoted to this industry, and I think this is something that we can really help the people daily life. But the concrete to focus on the regions, because this also reflects my own heritage. I come from China, obviously. I have been in Germany for 20 years. So yeah, very inherent motivation for this.
Yeah, and you talked about barriers in how to exchange data. What could be one example, a quick win that could be possible with the technical solutions now today to bring those data sets closer together?
Yeah, I think we already, just two examples. One is Germany, one China, quick. So Germany, I think, for example, when every time you go to the doctor, many data already shared with the insurance company because you don't pay yourself, right? If you're a sedator, pay. And this data was not open for research or the startups to use them in the anonymous way to develop products. Now the new laws would enable them to use this kind of data to like drug development clinical studies. This is the number one example in Europe, in Germany. The second in China, China is beginning now recognize more and more norms and standards of the different clinical studies. Because 10 years ago, if you want to do clinical study in China, you have to redo it with the Chinese population, which takes time and delay your drug introduction, cost you billions. And now Chinese government say, we want to be in the global standard. We don't want to only play our own game. And this is all a good sign for collaboration.
Yeah. And have you seen now any concrete signs of COVID accelerating the openness and willingness in the healthcare ecosystems to work together? Or is there always this political barrier in between?
Yeah, I think the COVID also like exposed many of the deficiencies and many of the problems. But in the good way, you know, because only if you have pressure, you would move, you would improve. So I'm always an optimist. I try to see the best of every situation, and this is true for COVID. As I said, it's not something we wish for, but I think we have already done greatly to learn from this and to see where we can do better, where we need new legislation, but also from everybody in the room is we need a new mindset as well. How we treat with our data and how, you know, with confidence, we should use our data to improve our daily life.
Yes. Thank you very much for this. Chen Liu, ladies and gentlemen, of SILREAL. Super interesting.